You're going to intro, right? It's
I'll
your interview.
intro. Okay, hi everyone. Welcome back to the Charlie Veitch channel. I have a particularly special one, a juicy one, a tasty one, a delicious one for you all this Friday afternoon. We might as well start the weekend with a bang. I have none other than the forensic psychiatrist, Dr. Sohom Das. Hello.
Hello, Charlie, Mr. Veitch. It's a pleasure to finally speak to you in person after trying to sort this out for a few weeks.
Absolutely. And what a wonderful synchronicity, which I'm going to discuss, and we'll tear it apart in a Jungian sense during this call. But what a wonderful synchronicity that all my viewers should know that Sohom and I were at Edinburgh University at the same time in different faculties, 1 year apart.
And
Yeah, you were there in 97.
That's right, 97 to 2003. And you were there a little
And
bit
I was there
later?
98 to 2002. You know, mine wasn't medicine, so mine was a short 4-year philosophy course so that I could get a job at McDonald's flipping burgers quite happily.
We possibly might even recognize each other, we were saying before, but we're not sure. It could be false memories. It's hard to know.
Yeah, it could be false. You know, that's a lot of delusion going around, Sean.
So I heard.
So I wanted to start off with the big guns. Okay, is psychiatry real?
I think that is a reasonable question, and it's obviously a question that a lot of people ask. You know, there's a big anti-psychiatry movement. There are people like Scientologists who don't believe in it as a science. I think it's real. Obviously, I am biased. What I can say is that I think there's a softer type of psychiatry which is a bit kind of wrapped up in well-being and can be seen as some people by mumbo jumbo, which is more. It's not really mental illness; it's more mental health. And I'm not saying that doesn't have any value, but it's not serious mental illness. It's not what I'm used to dealing with. And then you've got the other end of the spectrum, which is very much my kettle of fish. You know, so schizophrenia, bipolar affective disorder. So I'm a forensic psychiatrist, so I specifically deal with people who've committed serious violence. So what I can say is that I've seen many, many patients in my career come into the secure units who are in extremely agitated states, who are hearing voices, who are delusional. We treat them, and it's not a very simple process. It's not a bed of roses. There are things like side effects. There are patients who get agitated on the ward. There are people that have fights. There are people that abscond. There are people that commit violence on the wards. So it's not a walk in the park. But eventually, after a couple of years, I see them leave in a much better state than when they've entered. That doesn't mean that it's a fairy tale ending. There is quite a high proportion that will reoffend, or there's recidivism and they'll come back into the system. But they definitely have a better chance of surviving in the community when they leave compared to when they arrive. So I think psychiatry is real.
Okay, no, fair enough. And off the back of that, I expected you to answer along those lines, so that's good. I've not been shocked yet. But would you say then that the jurisprudence of our planet, or at least in the West, has a non-materialist theory of mind? The reason I ask is because obviously your job is to find out if there are hardware or software issues with the mind of the individual. Now, you might struggle to find hardware difficulties without chopping their head up, but you can find the effects of those hardware difficulties. So does British justice have a non-materialist theory of mind?
Wow, I only understood about half of the words that you said then. What I would say is that, honestly, I think that psychiatrists, myself included, we don't really think of it as a philosophical issue. We think of it as something's broken, can we fix it? So I'll give you, maybe just before I answer your question, maybe to put everything in context, it might be helpful for your viewers if I just give you a very quick summary of what I do. So as a forensic psychiatrist, I assess people who've committed very serious crimes, who either have definitely or are suspected of having severe mental illness. So as I mentioned before, schizophrenia, very common, bipolar, personality disorders sometimes. And there's kind of two different aspects to my job. So there's the assessment aspect, which is the expert witness work that I do. So what's somebody's mental state at the time of their offence? And crucially, are they criminally responsible or not? Which I think is what you're asking me about, which I'll come back to.
Yeah.
And then the second part of the process is rehabilitating them once the very few, and it is actually only a very small proportion, who are deemed so unwell and not criminally responsible for their actions, get sectioned under a criminal mental health act, not a civil one, to these secure units that I was talking about. So I've worked in those secure units in the past and I did my training in them, but right now I work exclusively for the courts to do the expert witness assessments just because I personally find it more interesting. So that's just to put everything in context. Now, I think what you're basically asking about is free will, isn't it? Is that right? Because I didn't understand
it's free will.
Yeah.
Well, basically, like what I mean by a non-materialist theory of mind is that, from what I can tell, your job is to assess whether the machine is working correctly to produce a good ghost, which would be consciousness, sentience, subjectivity.
Yeah.
That would be the ghost. So is the machine producing a decent ghost? And so your job, I guess, would be, oh no, the machine's a little bit messed up. It's not quite firing correctly. So the ghost of consciousness is delusional or paranoid or schizophrenic.
Yeah.
So there is that mind-body separation, like almost Descartesian theory of mind, because if it was a materialist theory of justice or theory of the human being, we would be very Old Testament, biblical, the old phrase from the Bible, judge a man by his fruits, what he does, not what he says or how he is, but what he does. To give you an example, there was a stabber last year in the Arndale shopping center. He broke up with his girlfriend and he stabbed 5 people. He bought a small knife, stabbed 5 people badly, got tasered and arrested. And the forensic psychologist I read in the Manchester Evening News, forensic psychiatrist, said this was one of the strongest cases of paranoid delusional schizophrenia he had ever seen.
Yeah.
But there was something in the back of my mind going, well, we're all ill. We're all full of shit. We're all fucking suffering. We've all been abused. I don't pick up a knife. But then people say, well, but he's got things misfiring in his mind. And I'll let you respond to that because I've got something quite colloquial I want to add.
Okay. Right, I'll respond to that. So I don't know about that specific case that you're talking about, but I've assessed many, many cases that are very similar. So ultimately, there's kind of levels to my assessment and to the kind of theory behind it all. So the first thing would be, does he have a mental illness, yes or no? So it sounds like this particular guy clearly does, schizophrenia. More importantly than that, what was his mental state at the time and what was his intentions at the time? So if he had schizophrenia, if he's just, to put it in layman's terms, just a bit of a nasty piece of shit, he's somebody who's antisocial, who intentionally is hostile to people, has a lack of empathy, doesn't care about the difference between right or wrong, which is more in the territory of a personality disorder. But if he has these things and he just got angry because his girlfriend broke up with him and he went around stabbing people, then the point of my assessment would be to elicit all of that and to say to the judge, yes, he does have schizophrenia, and he might even have been hearing voices at the time, but the most important bit is that he knew what he was doing, and he knew what he was doing was wrong. So that phrasing that I just used, the last bit, is basically the insanity defense. So to prove that somebody is not guilty by reason of insanity, they either don't know what they're doing, or they don't know what they're doing is legally wrong. However, in another set of circumstances, which happens far less often, but does come across my desk, probably 15 to 20% of the cases that I see, there will be somebody who has paranoid schizophrenia, is hearing voices and truly believes that they're doing the right thing. So they might believe that, for example, the other people around them are assassins or zombies or aliens, and that the whole world's in danger or his life is in danger, and therefore he has to go and stab and kill them. That might sound extreme, but that's not atypical. I might see something like that every few months in a presentation.
Yep.
Or has been hearing these voices that he genuinely believes. That's the problem with psychosis. You don't have insight. Hear these voices that he genuinely believes that he has to listen to, otherwise something bad will happen or he will die, and the voices tell him to go and stab somebody. So it's not just about the diagnosis. It's not about if somebody's ill. It's about their actual mindset at the time. And I think there might be a misconception, and understandably so, that people like me just try and get people off who
I know what you mean.
who are mad rather than bad, if that makes sense. But
you're
actually,
a bleeding heart liberal. You're a bleeding heart liberal, and you're going to free all the rapists and the pedos.
Exactly. But actually, I think it's the opposite. I think that just statistically, and this is not something I fashioned by design, just of the cases that I see, only a very small proportion, I think, ever reach that threshold of a guilty plea, and only a very small proportion need to be transferred to hospital, a secure hospital rather than prison, because we have psychiatrists in prison. I was one myself a few years ago. So the point I'm trying to make is that we're the filter. I'm the filter for the very small proportion right at the very top who don't have criminal responsibility. And that is a small proportion. The vast majority of people do. And I've not even talked about alcohol and drugs. That's a huge factor.
Yeah.
In fact, I go as further than that. I'd say that more defendants that I see as an expert witness are influenced by alcohol or drugs than they are by mental illness.
You know, as you were explaining it, my deep, human-loving British sentimentality was shining through. And when you're describing it's a very small number of people of all the crimes that need to be assessed. I guess the point behind that is, a moral, ethical thing is someone literally cannot help their actions. If they're so deluded that they believe they're a cyborg and the demons are about to get them and they end up hurting some old man by punching him because he's like the king demon.
Yeah.
I get it. From a philosophical and a moral point of view, does that guy deserve the same punishment as someone that went out and watched pornography all morning, got fired up and raped someone or, something like that?
Absolutely.
So, but coming back from how I started, I asked you, is psychiatry real? If you go on to, say, the Wikipedia definition of psychiatry, it's very open in terms of the criticism and the problems with it. Is it a science or is it a social science? And I can see how, of course, doing trials to see which medication helps with delusions, schizophrenia. You mentioned in one of your podcasts a year ago, it's a fine balance because it can give you cardiac arrhythmia if you're on the antipsychotics.
Yeah.
And no, I get it. But do you ever think that, as we understand science and human anatomy and the brain and sentience and everything a lot more, we're going to do what Daniel Dennett did in his book, Consciousness Explained. We're going to explain consciousness away to the point where no one is responsible for any of their actions because we all have a particular genetic brain structure that comes. We all have a particular environment we grew up in. And if I didn't grow up with a silver spoon in my mouth and then someone insults him, I'm like a kind of radical Islamist, and someone insults my religion, I might do something terrible. I guess where I'm going with this, I guess I'll just ask you, is psychiatry more a science or a social science?
Okay, I'm going to ask that bit first, and then I want to come back onto, I'm just going to write this down because otherwise I'll forget. Explain behavior. Okay, so I think it might make for a really good viewing if you had this like really passionate psychiatrist who really doesn't want his specialty to be questioned or slagged off in any way and got really defensive about it. But I've got to be honest with you, I'm not that defensive about psychiatry. I have experienced a stigma against it. So like really simple way of putting that is the vast majority of people who don't even know that psychiatrists are doctors. So there's a big misconception or misunderstanding between psychiatry and psychology. Psychologists are not doctors. They only study psychology. Psychiatrists are doctors first, go to medical school, then finish it, then, specialize. And the point I'm trying to make is that it's definitely not as respected as a medical specialty or even a science than something like cardiology, general medicine, et cetera, et cetera. And that's something that I've got used to over the years. Even when I was working in a hospital in the Edinburgh Royal, in fact, you could just feel a sort of vibe, not of all, but of some doctors that the psychiatrists are not really pulling their weight. They just talk this vague mumbo jumbo and blah, blah, blah. And I kind of get that. And I'd even agree with it to a degree. What I mean by that is, when you have somebody that comes in, so again, taking the Edinburgh Royal Infirmary it was as an example, I'd work on the liaison psychiatry. When you see somebody that came in with like chest pain, or no, actually, let's take like a suicide attempt. They've taken lots of paracetamol. That's exactly the kind of patient that I would see back then. So the medics do what they have to do, and it's all very, very scientific and measured. You take your blood test, you know exactly how much paracetamol there is. You figure out how many hours it's been in the system. You take liver enzymes, so you see how damaged the liver is. You know what the antidote for that is. You measure it by the millimeter. It's very sort of black and white and calculated. The psychiatry behind it all is very soft compared to that. So it's a lot of talking. It is trying to sort out people's problems. There's a lot of referring to drug and alcohol, to relationship counselling, blah, blah, blah. So actually, I think it is more of a social science than it is a hard medical science. We do medicate. And our medications, as you alluded to yourself, are rough tools. So they just blanket block loads of receptors in the hope that your psychotic symptoms will decrease. And they do kind of eventually, if you throw enough shit at it, basically. But they're not scientific, and they never have been. And I wouldn't claim that they were. And even to kind of extrapolate it, the patients that I see that come in that offend, they're in our units for years, in these secure units, low, medium, high secure, like Broadmoor. They're in there for years, and only a very small proportion of it is getting their medication right. I'd say maybe 5 to 10% of the efforts that we put in is that. Most of it is things like psychology, so looking at their factors, looking at risk factors that cause people to offend, whether that's previous history of abuse, being part of a gang, drug and alcohol, as I said before, is a huge, huge thing. And then on top of that, we help people with occupational therapy. So you get people that come, professionals that come in, occupational therapists that help with their vocation, give them college courses. And then you get a social worker that comes in. So actually, only a very small proportion of it is what you would term hard science, and I think a lot of it is the social sciences is building a social support. It's like, you could even say, if you're very cynical, which I'm kind of, it's like glorified social work, but there's still complicated bits to it, like the Mental Health Act in itself and the medication that I talked about. So I can understand why people have a kind of warped view about whether it deserves to be called a subsection of medicine.
Sohom, I admire your humility and also your openness to criticism. I think you're probably not mentally ill yourself. Speaking of mental illness, thank you very much for that. I get what you mean, like when you say glorified social worker. Your average man or woman on the street probably doesn't have a high opinion of social workers because they're associated with broken families and disaster and things coming in. And I can see how your job could be similar to that. My mother, is a criminal lawyer, hasn't worked for a long time. Her mother was a gynecologist. And my granny, Brazilian granny, and my mother always said to me, like when I would be at university and talking, oh, this guy's got mental problems or this. They're like, no, Charlie, don't let them off the hook. No, only people who rip up money are crazy. Everyone else is just a bit weird. So they're not crazy. So, I struggle sometimes when I watch the news, and I'll be careful because I want us both to monetize this video and for not to be like the YouTube censors to destroy it. So I'll choose my words carefully. There's been a high-profile policeman who got a life term without parole possible ever for the Sarah case. You're nodding. You're familiar?
Yeah,
with
absolutely,
this? Yeah. And I watched his arrest video when the detectives went to his house. And he started whimpering and inventing Albanians that they needed to catch a girl. And then there's countless, so I can't name a particular case, but I'll give you a general story. A mother does harm to her babies in the bath to the point where the babies pass away. And then she's like, everyone's like, oh, poor woman, she's mentally ill. And she didn't know what was going on. For me, as a dad, and you're a fellow dad as well, I've got a daughter. The Sarah issue boils my blood, but I can almost see how a man working in his job can go mad, power mad. He's got fetishes. This idea rolls around in his head. I must do this. It's like he needs the thrill, which is a mental illness in itself. And so they put him in jail, thrown away the key, and yet someone who's maybe done the same thing to 4 little babies in a bathtub might get, diminished responsibility, manslaughter, 7 years, and then probation with doctors. It just doesn't sit right, Sohom.
Okay. So yeah, I've definitely got responses to that. Are we not allowed to say his name then? I didn't actually know that's how YouTube works.
Because I've got 2 community guideline strikes, I just need to be very careful.
Okay.
What I say. And the AI algorithm, it finds keywords, and so I've learned almost like a kind of Soviet spy in the West, how to kind of blend in.
Okay, I literally didn't know that YouTube did that it would take keywords. I knew like really offensive words like the other word for child molester. I knew that kind of got struck down, but I didn't think that like news items or people would. So I'm just intrigued to know that. So. Again, I think it all boils down to whether they had criminal responsibility or not. So the person that you're talking about, you said before that he might have been kind of obsessing over these sexual desires, and that is a mental illness. I would respectfully disagree with that. I don't think he had a mental illness. Actually, I'll rephrase that. I don't think he had a mental illness that directly drove his offending or controlled his actions. So he might have had a degree of depression. He might have had a degree of anxiety. Almost everybody that I see who comes through the court system has an element of those. That's not relevant. So I think what's happening is that some people are tarring everybody with a mental illness into the same category, and it's not like that. So those are mild mental illnesses that do not have an effect on somebody's culpability, or somebody's ideation, beliefs, somebody's reality. Whereas a psychosis. So I think I'm allowed to say the name of the other person you're talking about. I think you're talking about Andrea Yates. Is that right?
It might as well be. Yeah, she's been in the press very recently, hasn't she? In the last day or two.
Oh, really? I didn't know that. Didn't know that. So you're more up to speed in my specialty than I am. But I've actually, for your viewers, I will shamelessly plug my YouTube channel at some point later. But I've done a video on her. She's called Andrea Yates, and she drowned her 5 children in the bathtub. Tragic. 2001 woman, a nurse from Houston, clearly psychotic. She'd been suffering, from post-pural psychosis, which is psychosis after you've had children, many times. Been in and out of hospital. Been sectioned way before this happened. So I suppose what I'm saying is this is a clear established pattern of mental illness. As soon as she didn't try and hide it. She literally phoned the police herself immediately. She said that she was hearing the voice of the devil. She said that she believed her children were marked, and that she didn't end their lives, that they would go to hell straight away. And I'm going off a bit of a tangent, but interestingly, she was initially sent down for murder because of some incorrect evidence by one of my brethren, a forensic psychiatrist who was working for the defense. And then it got appealed, and the case was heard a couple of years later, even though she'd have been in prison. And then she got this finding of diminished responsibility, which you talked of, and ended up going to a psychiatric unit, which I think she should have gone to right at the beginning. But the key issue is coming back to what I said before, like the insanity defense. Diminished responsibility is similar, but not exactly the same. There are very specific legal criteria. I won't go through them all because I'll fall asleep by the time I get to the end of them. But the essence is about whether they knew what they were doing, whether they knew what they were doing was wrong. So
can I just jump in very quickly? Let's jump in. She knew enough what she was doing was wrong to call the police straight away, didn't she?
Yeah, that's a good point. Actually, I never thought of that. I mean, yeah. If you, and a counter argument to that, and I can't say for definite because I didn't obviously assess her at the time, was that if you came into your house and you found a dead body, you would still phone the police. Doesn't necessarily mean that you're thinking or admitting guilt or thinking in your head that you're guilty. So I think she felt compelled to do it, even though she knew that she was like ending somebody's life. At the point I was making about the police calls, she wasn't trying to hide it and then retrospectively pretending she was mentally ill. She literally told everybody, her husband and the police immediately. So as opposed to somebody that went on the run who tried to then retrospectively, which would kind of blur the picture. But the policeman you're talking about, I don't think it could be argued from any forensic psychiatrist that he didn't know what he was doing. It was completely pre-planned. He had even practiced the driving route a couple of times. Might have had a sexual perversion, might have had a personality disorder. So that's the whole conversation, the difference between a personality disorder and a mental illness, the two very different concepts. Whereas Andrea Yates, she clearly had a psychotic illness. And the other thing I wanted to say is that if you get diminished responsibility or even the insanity plea, so just very quickly for your viewers, not guilty by reason of insanity is for any offence, literally anything. And it means in the eyes of the law, you're completely not guilty. So you have not committed a crime in the eyes of the law. Whereas diminished responsibility is only for murder, and it downgrades murder to manslaughter. And as the name suggests, it means your responsibility is diminished. So you're not fully off the hook. You're deemed partially criminally culpable. But what I was going to say was that either of those defences doesn't mean that the defendant's just released from prison, gets to walk the street. Either of those defences means that they go to a psychiatric unit for this long-term rehabilitation, which is where Andrea Yates, to my knowledge, is right now. Although if she's been in the press, maybe she's left recently. But it's not an easy ride. They have this really intense rehabilitation. But I suppose the difference is conceptually, prison is for punishment, rehabilitation is a bonus, whereas hospital is for rehabilitation, and you don't get to leave until your consultant forensic psychiatrist decides that you're safe enough to leave. And that can
Fair
actually
enough.
be longer than the tariff. So there's
Yes.
patients that I've treated that have been in for decades, even though what they did wasn't that serious. And it's nothing to do with judgment or punishment. It's just they're not safe to leave because of their mental illness.
No, of course. And final point I want to make about the policeman in question. An alarm bell that rang for me that said this guy is clearly nuts is he was a high-ranking detective, special firearms, diplomatic protection. He knew his shit as a cop. And I watched as much as I could about it. They caught him because he was caught on multiple dash cams with his own license plate pulling over Sarah on the side of a main road. Now, if he was evil, and I just want to say to all my viewers, I'm not defending what happened. If anyone tried to do that to my daughter in the future, I will chop their heads off, and that's the end of that. But just to try and be cold and clinical about it, he knew that he was mad. If he was acting rationally and evil, as I've got a personality disorder, I'm going to go and have my kicks and act like the devil, he wouldn't have done it on the side of a main road where everyone was seeing him. I'll let you address that, and then I'll move on to something else.
Yeah, I really can't explain why he did that. I think that's stupidity rather than any kind of mental illness. I think he just didn't. And I'm thinking through it in my head now. If he is a policeman, he should have known, really, shouldn't he?
Even us, we know that.
Yeah. I just think he was really clumsy and stupid. I don't think he was mentally ill.
Fair enough. Then we'll call what we've just talked about Chapter 1. Let's now enter Chapter 2. So, okay, Chapter 2. I watched a film, a very recent film. It won an Oscar. Anthony Hopkins won an Oscar for his portrayal of a elderly gentleman's descent into, quite strong dementia, and it terrified me. It terrified me because the psychological portrayal of it disorientated the viewer to the point that you felt you had dementia, and it was very humiliating, undignifying, and everyone in the movie tried their best to work with him. But I kept shouting at the screen in my head, saying, why doesn't anyone just tell this old guy the truth, saying, you are suffering a hardware collapse, you have dementia. Why can't we tell people with dementia the truth, Sohom?
Yeah. I think we can. I can't see any logical reason why you can't. I suppose if you've got if you're developing quite a severe degree of dementia, then of course your memory is affected. That's one of the key symptoms. So it's not necessarily as simple as as telling somebody. It's getting them to understand and remember that. And generally, the dementia, you tend to have confabulation, which is where you fill in bits of memory with your gaps in your memory with false ideas unintentionally. And you tend to go back. So when you are filling in these gaps, you don't go back a few weeks or months, you go back years. So the point I'm trying to make is that not for everybody all the time, but for a lot of people with dementia, they won't know or necessarily believe that they're suffering from this. So imagine if you had these memory losses, but you didn't know you had them. And imagine if your, friend, wife, whatever told you, Charlie, I think you've got dementia. You'd be like, well, that doesn't make sense. I don't remember forgetting anything. Does that make sense?
Yeah.
So I don't think there's anything wrong with telling somebody that they have dementia. It's just a matter of whether they will remember and whether they'll actually believe you. And I suppose a connected kind of question would be, what's wrong with telling people they have delusions? Again, well, delusions are slightly different, but delusions are fixed and unshakable by their very nature. So it doesn't matter if you tell somebody they've got delusions, they're not going to believe you. In their head, it is very, very real.
Yeah. No, fair enough. I watched... one of the reasons I asked you, I watched a YouTube clip by the actor Viggo Mortensen. Do you know who he is?
Yes, I do. Yeah, he was
a Lord of the Rings, History of Violence.
Yeah. Captain Fantastic. He was in that.
That's him. Great film. Oh, I love that film. Oh man, I've forgotten about that one. He also played the driver in The Green Book.
Yes,
with the black musician.
That is a great film. Love that film.
Yeah, and he did a podcast on YouTube. Saying, my dad's got dementia, and everyone watches. Like, I gotta just roll with him and what he believes in. And he almost answered the question I asked you. He says, "Look, we gotta go in their world and be in their world and believe the things they believe, because to do otherwise is cruel. Because we're expecting the dementia person to fit to our worldview instead of going into their worldview." And I was watching it, going, "Well, I get it, but I don't know, man. Like, could you make someone's dementia worse by not calling them out on the delusions?"
So before I answer that, something that's just come to my mind, which kind of fits in, is there's a Scandinavian, I think it was Sweden from memory. There's this kind of new treatment. I don't know if treatment's even the right word, but maybe even social experiment's a better phrase, where they have this nursing home and they create it to make it look as if the people, and they're all the patients there are all elderly people with dementia, as if they're in like a holiday village. So they think they're on this like permanent holiday, like they actually have a bar with waiters and waitresses, etc., etc. I think they probably, I imagine, water down the beer, but everybody there is in a fake kind of Truman Show world where they all think that they're on this permanent holiday, where they're and you know, things like medication is hidden from them rather than them being in a hospital.
Like Shutter Island.
Yeah, yeah, like Shutter Island. Less violent though. So your question was, sorry, I lost my train of thought. Your question was, could you make their dementia worse by going into their things? I think you can make somebody's delusions worse, absolutely. So I'm talking about things like schizophrenia, delusional disorder, which is similar but not the same, psychotic depression. You can make somebody's delusions worse, absolutely. But I don't think you'd make somebody's dementia worse by buying into their ideas. So no, I don't think that's the problem. But so in my training, I worked on a old age psychiatry ward, and a lot of the patients there had dementia. And the one thing that really struck me is they tended generally to fit into two camps. There were people who were very placid, elderly, lovely people, men and women, very, very placid, and there's nothing in their behavior that seems in any way kind of agitated or confused. But if you spoke to them, they clearly had absolutely no idea what was going on. They would literally forget who you were within minutes. You come to speak to the same person on the same day, and they act as if they've never met you before. And sadly, another smaller but significant group were people who were just constantly frightened and constantly agitated, and they would ask the same questions over and over again. One woman that really sticks in my mind was this poor old sweet woman who was constantly asking where her husband was, and she didn't know where she was, and she was asking, why am I here? Who are you? We'd tell her we're in hospital. Why am I in hospital? Where's my husband? Is he going to come and pick me up? And you'd answer all these questions and you reassure her, and you'd see like the fear from her face drain. And it would take time, take effort, take like a good 15, 20 minutes. And then literally within 5 minutes after you've left, exactly the same questions, exactly the same worries. So this poor woman's got these fears over and over again on repeat in her mind. The reason I mention this is because, again, it's not about whether you agree with her or not. She's not going to remember either way. If you ignored her, which would be a horrible thing to do, and walked away, if you reassured her and walked away, if you told her a lie and walked away, if you swore at her, if you were an evil piece of shit and walked away, it would have an effect on her on that moment, but 10 minutes, 15 minutes, half an hour down the line, it would make absolutely no difference. So it's not about making them believe something. It's about the fact that they're in this perpetual state of not being able to understand their surroundings.
My goodness. You must be, well, you may know, was he a psychologist or a psychiatrist? Dr. Oliver Sacks.
Dr. Oliver Sacks, I believe, was a psychiatrist, the man who mistook his wife for a hat.
The 1985, the man who mistook his wife for a hat.
Yeah.
And I watched the documentary off the back of that, discussing the narrative collapse, the conceptual abstraction collapse of people who have had a stroke. And I saw a guy, I think Dr. Oliver Sacks was supervising him. He was like, right, draw me a flower. And the abstract concept of right-hand side was gone from the guy's sentience. And so he drew half a sun with petals down one side. And the doctor goes, oh, please draw the other side of the flower, the right-hand side. And the guy, he became argumentative, and he changed the subject to try and avoid the concept of right-hand sidedness. Yeah. And I saw his mind finding a narrative, searching for any narrative to continue the conversation. And of course, he became angry because the mind couldn't find a kind of the abstraction of right-hand sidedness. Yeah. And that absolutely terrified me, Sohom. And I'll tell you why. I guess my philosophical beliefs are very tied in with my theological beliefs. I have almost a Sikh understanding of the universe, in that everyone is an avatar of God. And, and I try and use it to kind of philosophically explain a lot of things. The problem of evil and suffering can be simply resolved if everyone is an avatar of God. I've read Arthur Schopenhauer. He talked about all of reality as will and representation rather than the material world. But watching that man literally have no concept of rightness, not right or wrong, but literally right-hand sidedness.
Yeah.
It made me really challenge my theory of mind, my theory of consciousness.
Wait, hang on. Can I ask why did it challenge it? Like, why are those two things, do they have to be separated?
Because how can you be 3/4 of an avatar of God? How can you have half a sentience? How can you have 3/4 of a sentience? How can you not be a person? And that guy on the video was clearly missing an element of his fundamental essence. And that
But surely,
it gave me the heebie-jeebies.
Surely, when you're really, really drunk or stoned, or when you're half asleep from being tired, surely all of those things you have less than full sentience, don't you? Or even a child would have less than full sentience.
Yes, but that might be distracted, as in, I can visualize that. Like if there's a little man operating my brain, a little man at the levers in my brain, and then he's distracted. Oh, the liver's suffering. And he looks down, and then something happens. Charlie, were you paying it? Oh, sorry, I wasn't. But this guy, even he was paying full attention, could not understand right-hand sidedness. So to kind of turn this into a question, have anything about your life, your early life, your family, or anything that you believed beforehand helped you or hindered you in your psychiatric work?
My honest answer is that you talk about and think about things far more philosophically than I ever did or ever have done. So yeah. I have never really thought. I mean, obviously I have a heightened awareness of the concept of criminal responsibility, because that's literally the epicenter of the work that I do and the assessments that I do. So apart from that one thing, I don't think I've really thought about like consciousness or sentience in general.
That is very surprising considering your job.
I know, but my job is to... All right, first of all, I've got a big turnover, so there's always loads and loads of patients to assess. And ultimately, I write reports for the judge. So the judge reads the report and they decide off the back of my report whether this person's going to prison or hospital, whether he's getting a psychiatric defence, and potentially even how long his sentence is going to be, if there are mitigating factors or not. The judge doesn't want to know or care about like the philosophical issues behind all that. Does that make sense? So with respect, that's not really my job. My job is to assess people to see how bad versus mad they are, and then if they are very mad, to try and rehabilitate them. So I've never really thought of anything like that. But to answer your question, I don't think so. I mean, my parents are Hindus, and they're both very religious. They meditate every day, for example. They're very. I'd say they're more spiritual than they are religious, and I've been around that all my life. I believed it when I was a kid, and then I started to grow my own opinions, and from the age of maybe, 10, 12 onwards, I didn't really believe it. I never have. Respect it, got nothing against it. And I take them to temple, not very often, once every few months. And I'll sit there and pray because it'll make them happy for a couple of minutes. And then I fuck off and do my reports in the coffee shop and leave them there. And so I don't have anything against any religion, but I don't buy into any of it. And in terms of sort of consciousness, I've never really thought about it. Or, well, actually, that's not fair. It's not that I've never thought about it. It's never been important enough to affect the work that I do. So I'm sorry, I can't give you a more detailed answer, but I don't.
No, that's fair enough. Maybe
I'm emptier up here than you're giving me credit for.
No, you are the perfect Hindu meditator. You're just clear mind. That's it, clear mind. But is there, in our modern parlance, we'll say, in fact, I'll talk about it. I watched a wonderful true crime, That Chapter, or was it Coffeehouse Crime? The guy was Sir Richard Holdsworth. He was worth 300 million, got stabbed to death by his stepson and the mother, quite recent in the last year. One of the richest men in Britain. And I listened to the voicemails that the murderer said. And he goes, I'm terribly sorry. I let my anger get the better of me. But wouldn't an ancient Greek guy say, the god of war, Mars, got the better of me? Wouldn't a Hindu, I don't know which is the angry god in Hinduism, but, I don't think we can throw out I'm not saying you are. I'm not saying you're throwing out all this stuff, but let me maybe rephrase. Personally, for you working with these, interesting people, it must be fascinating. Do you get any kind of like armchair theories of like what's going on, or for you, is it a science? Is it, as you described, a science?
I think it is a science, or at least a process, where you have to get the better. And also, I think kind of paradoxically, I kind of try my best to do the opposite. I try my best to take judgment away from it, because some of the people that I see, especially the ones that end up in hospital, have committed quite horrific offences. Some of them have been sexual offences, some of them even on children. Several people that I've worked with and helped to rehabilitate have killed people, even family members. Yeah. And there's a spectrum of how mentally unwell they were, but if they've made it to hospital, then they must have been psychiatrically unwell to a degree. And I try not to be too judgmental. I try to take away my moral judgment of what they've done and purely look at the risk factors and try and rehabilitate them. Because if we're accepting as a society that they're not fully responsible and that there's a mental illness, then it's almost petty for me to treat somebody who has killed a family member worse than somebody who has set a serious fire. Because I think they deserve the same shot of redemption, same shot at rehabilitation. So I'm talking about the people who are deemed not criminally responsible. So I suppose, apart from lack of time, lack of a philosophically wired mind like yours, it's also a lack of trying to be fair to everybody. So it is about what is wrong, like what can be changed, and do we have the resources? And if so, let's get those resources. And also, to be honest, a lot of it's pressure, time pressure as well. So there's always a queue of people trying to come into these hospitals. When I do my expert witness work, I'm getting emailed almost every day about another defendant that's coming in. I've only got a finite amount of time, so I've got to kind of churn through and do all the work. I don't have the luxury of getting to sit back and think too deeply about a case, because if I did that, then I wouldn't get to see somebody else, and they'd end up being on remand for weeks or months longer because of my philosophical inner ramblings.
No, of course. Let's move on to chapter 3 now. So, Sohom, have any of your patients ever caused you sleepless nights by being released from an institution and then hurting someone when they should have been in prison?
Oddly, the answer is no. Oddly, I have always been very good. Wait till you hear the rest of my answer before you say a few. I think that's because I am so sort of slightly psychopathic that I'm quite removed from the actions of my patients. So I don't get as emotionally riled up, I think is fair to say, compared to most people that I know. If somebody slags off psychiatry, I don't really care. If I see a defendant who has done something horrific, I wouldn't say I don't care, but I think I probably care less than some of my colleagues. My wife calls me a bit of a psychopath because I don't react to anything at all, like extreme violence on TV. When she's like shocked and hiding behind the sofa, I'm just literally eating my cereal. So I think I've always been good at being able to remove myself from what I see and what I do. And it would be nice. It'd be a nice story for me to say that, I've become inured over the years and my heart has become callous. But the truth is, I've always been like that. It's not because I did forensic psychiatry, and it's also not the reason that I got into forensic psychiatry. It's just a coincidence. I'm very good at putting myself at a distance. I've not had any of my patients that I've been worried about because once I became a consultant, which I have been since 2014, I make the ultimate decision on whether somebody gets discharged. So there's never a situation where I'm discharging somebody before I think they're ready, because it's literally my call. There is the one situation that might make me a little bit uncomfortable, is that a few times when I've worked in court diversion, I've made the suggestion to a judge to section somebody because they're unwell. And it doesn't happen often. It probably happens once a year, maybe twice a year. There'll be a judge that ignores my recommendation for whatever reason, either because they're an armchair psychiatrist and because the person in front of them doesn't seem that paranoid and doesn't seem that agitated. They think, I think you're being a bit precious, doctor. I think, they're fine. Or sometimes I've even had it where the process of trying to get them into hospital, the Mental Health Act, because it can't just be done by one doctor. You have to have an independent doctor, independent social worker. Then you have to find a bed in the hospital, blah, blah, blah. So the process itself can be very slow. It can take days. And so the defendant is re-remanded one night at a time. And there've been a few occasions where the judge, after 3 or 4 days, just gets pissed off and is just like, look, I'm not waiting again. You should have sorted it out. Even though there's nothing that I could have done to have changed it. I'm just going to release this guy. So there's been occasions where I've thought there's been somebody released onto the streets who is potentially dangerous and a bit psychotic. And there's nothing you can do. Like, I don't have jurisdiction over that. The judge, that if the judge disagrees, then their word is bond, so the patient will be released. You can sort of phone around and ask the community team to try and find their patient, and that's the best that I can do, but they've got a waiting list. They don't even, the patient doesn't necessarily go back home immediately. They might go out and smoke crack and try and stab somebody. I literally don't know what happens to them. So occasionally there are situations where I feel a little bit uncomfortable, but not usually.
Fantastic, Sohom. You know, you're like Dana Scully to my Fox Builder. If we were to do the X-Files around Manchester and go and look at crackheads and crazy people, I'd be like, oh, look, there's a soul there. And you're like, no, there's no evidence for the soul. Let's just do the process. And so you're like the kind of cold FBI agent. I'm the guy with the poster of the alien. I want to believe. And, obviously, probably the most profitable film in the last 20 years was Joker.
Yeah.
And much has been said about, obviously, Joaquin Phoenix's portrayal, but let's concentrate on the character, the fictional character, Arthur Fleck.
Yeah, it is.
How did he? Was that a good representation of a person? And what issues do you think he had? What did he have?
Do you know that I've done a video on this, or is this a random question?
I've not seen that one.
Okay, yeah. So I'm glad that I've done a video on this. Otherwise, I'd
link it below.
You'd show me up for not knowing anything. So I love Joker. It is a very good film, and I have done a video about this, and I'll tell you what I said. I think that it is actually not his mental illness that drove him to do what he did. I think that's a red herring. I think it was the social circumstances around it. So he's got this pseudobulbar affect. It's not named as that in the film, but that's what I think it is. So it's a very rare neurological rather than psychiatric illness. So it's not a chemical imbalance. It's a bit like your Oliver Sacks guy that couldn't recognize the right hand side. It's like a what's the word? A mechanical rather than a chemical issue that causes him to laugh inappropriately. Mm-hmm. So I think that it is. The reason that he turns into this supervillain is about, first of all, it's about his. So you can split it into historical, current. You can split it into historical and current factors. So historically, we find out later that he grew up in a horrific environment, from being physically abused by his mother. I think his mother's partner. He's got a head injury. So there's some indication, I think, when he's looking through his notes, that he received a head injury, which, as we've discussed, can damage your frontal lobe. It can make you more impulsive, can make you more aggressive. He's being bullied relentlessly. So he's bullied in the very first scene, I believe, by some kids who sort of beat him up and steal his sign. Bullied, or at least disparaged by his colleagues. The other clowns kind of laugh at him, but not in a good way. Yeah. And then, because his gun drops out, a series of events make his already pretty shitty situation even worse. So he loses his job. On top of that, his medication gets revoked because the services don't have enough money, apparently. And so all of those things are not mental illness. All of those things are social pressures that are affecting him. Yeah. And then on the backdrop of all of this, you have this kind of feeling around Gotham where there's an uprising from an underclass, and he kind of unwittingly becomes a face for that. So I think that kind of emboldens him, encourages him. It appeals to his narcissistic side. So here's a guy with a massive inferiority complex. All his life he's been told that he's worthless. Even as an adult, he's been told that he's worthless. And all of this... and then suddenly he has some value. So suddenly he's being respected. Suddenly people are taking him seriously, and he finds that if he shoots people like those men that he shot on the train, he has this power, whereas before he felt powerless. So you see the shift from a huge inferiority complex to a huge superiority complex. So I think it's all of those things, more than any other mental illness, that drove him to become the Joker. Now, having said all that, there are a couple of things that do indicate mental illness. So I think some of the scrawlings in his book suggest that he's a bit delusional. And also there's this kind of delusional memory of a relationship that he supposedly had with his neighbor. I have to say that is quite unrealistic. And I'll tell you why. Because when people who suffer from delusions, from psychosis, have these kind of experiences, they tend to be very choppy, and they tend to be bitty, and they tend to be a feeling rather than a very specific memory. So I've seen many people, many men in forensic psychiatry units who have delusional beliefs that women in general find them attractive, or that they're grandiose, and that they're sexually very prominent, and they will think that all women in general fancy them. But it's very rare, and I've never seen anybody that's had very specific delusions of facts like, I went out on a date with her, we had this
Mhm.
relationship. So
Yeah.
to answer your original question, that is not a good portrayal of mental illness. It's more a background feeling rather than an actual memory of specific events that have happened. But the rest of it, I think, is actually done quite realistically and very well. Yeah. So yeah, that sums up my thoughts on how Fleck became the Joker.
Fantastic. I'm going to definitely link your Joker video below because I know my audience would be fascinated with that. I was watching Quentin Tarantino analyzing the Joker, on YouTube, and he says something very interesting. He says that the director managed to get literally hundreds of millions of people in the audience around the world to almost become revenge-seeking, psychopathic, emotionally charged people. When Arthur was in the TV studio with the Robert De Niro TV presenter, Quentin Tarantino was saying every single person in that cinema audience was just saying, "Go on, kill him. Go on, the fucker deserves it. Give him what he deserves." And that gave me chills down my spine because I was one of those people. When he pulled the gun out and goes, "You're going to get exactly what you deserve," I was like, "Yes, fuck him, fuck him." And then afterwards, I was like, "Oh shit, am I mentally ill?" And I was like, "Wow."
Again, I don't think you're mentally ill. Well, I've not assessed you thoroughly enough, but from that interaction, from that reaction, I don't think you're mentally ill. I think you just got
Okay, yeah. So it's a question. Oh shit, am I maybe mentally ill? Is that a sign of mental health?
Well, if you're truly psychotic, then the experiences you have, the delusions that you have, so typical delusions of patients that I see would be that people are following them, talking about them, laughing about them. There are cameras planted here that are watching me. People, someone I saw recently believed that somebody was breaking into his house in the middle of the night and raping him. With those kind of beliefs, they genuinely believe them. So
Yeah.
I get your question. Your question is if you think you're mentally, so those people don't know they're mentally ill. They think
Yeah.
that's reality. And if somebody tells them,
Yeah.
you're delusional, they're not going to believe that person. So I suppose for that small proportion of people, they don't know they're mentally ill. But more people who are sane will question their sanity than people who are insane, if that makes sense.
Very interesting. Very interesting. I've got a few points that are kind of coming off the back of this. So I'll be careful for the YouTube censors how I present this. Obviously, as a philosophy graduate from Edinburgh University, I have explored my consciousness. I have experimented in illegal jurisdiction, shall we say, with lysergic acid and dimethyltryptamine. I'm not going to say their colloquial names in case the YouTube censors kick off. But in the height of my, say, psychotic journey, I was like, wow, maybe, if I stayed like this, with everything's hallucinating, must be what insanity feels like.
Yeah.
But then I started thinking, if I literally had to, if I suddenly had to sit down and behave and have an interview with someone, I don't think I'd be able to do it. But I could certainly express to that person, like, please forgive me. I think I'm going all funny in the head. But a truly delusional person is beyond that. They're not able to express to the person, like, I think I'm delusional. I think I'm having a moment. They're not, are they? They're not able to.
Before I answer that, how did you do it legally?
No, that's just for the politics of the video. I didn't do it legally.
Okay. Okay. I may or may not have had very similar experiences to you, but I also would not say that out loud.
Yeah, exactly.
But so I think it's actually very, very, very similar. I would imagine, like when you're tripping, what you're talking about, I think the experience is very similar. Obviously, it's a lot more visual, whereas in psychosis, auditory hallucinations are far more common actually than visual ones. And I don't know about your experiences, but you probably didn't have a delusional belief. You might have had some paranoia or like a sense that something was wrong or different or separated. But the very fact that you knew that it wasn't reality, by definition, means that it's not a delusion. It could be an overvalued idea, which is like a diet delusion, if you want. But I think people that are truly delusional genuinely believe what they are experiencing, so they can't say to somebody, sorry, I need to put it together, because their reality, they won't believe the person they won't believe any other people. So they genuinely, if I told you now you don't, so you said you had a daughter, if I told you now you don't have a daughter, you'd be like, well, obviously I'm talking bullshit. Exactly. Yeah. So it's that level of belief that a true delusion that somebody will hold. They just cannot see that the other person's making sense. They genuinely believe.
Fair enough. One of the most fascinating and dark disorders that I've seen portrayed in many films, I think it was in Sixth Sense, when I first saw it, the Bruce Willis film, I See Dead People film. Munchausen's by proxy, usually a mother for attention and, with loads of narcissistic supply. Oh, my kid's ill. So I guess Munchausen syndrome is when you're doing it to yourself, but by proxy is when you're doing it to someone else, a family member, a child, or dad, or parent. In a recent video, Sohom, I associated the extreme, I guess, even beyond what the data, the pandemic, let's say it's X deadly amount. I've seen people with the PPE and the distancing and the precautions and the hand sanitizer to such an extent that I associated it to a bit of self-Munchausen's, like in a weird way, like, the mask and everything and stay away from me is like also with a bit of, narcissism thrown in, like I'm so secure. Maybe I was getting it wrong. It's not so much Munchausen's. There was a doctor that was on the Joe Rogan show. He talked a lot about mass formation psychosis, how people go mad. They fixate on one danger that the government gives them and they go mad. I'd like to ask you, Sohom, just generally, not directly in answer to what I've been saying, but what psychiatric conditions have you seen coming out of the pandemic, not just on a personal level, but on a societal mass level?
Yeah. Before I answer that, I just, again, are you, I've done videos on Munchausen's. Did you ask me because you've seen those videos, or is this, again, just a coincidence?
Again, by coincidence. Right. I've not seen that one either. All
right. Well, so just to shamelessly plug myself for your viewers, I've done a video on the case of DG Blanchett. So she was a young girl whose mother had Munchausen's, who put her through loads of unnecessary treatment, made her convinced that she had cancer when she didn't. She ended up killing her mother. So it's a completely shocking case. And I've also done.
What she fucking deserved.
Okay, no comment. And then I've also done a breakdown of the film Run. So that's a Netflix film about. Have you seen it? About a similar situation, a girl with Munchausen's who tries to escape her crazy mother. Right, to answer your question, so what you're describing with the pandemic and the anxieties about getting ill is not Munchausen's. The reason being is because Munchausen's is a very, very, very bizarre illness. I think I've only ever seen it once in my career from memory, and that was in Edinburgh, actually. And it is very difficult to understand. Even I don't really fully understand. I mean, I've read the textbooks, but I don't actually understand why somebody would do this. And it's the process of being ill. So it's almost like the sympathy and the attention that you get that is the driving force. So if it's by proxy, it's usually a mother to a child. And they want to fulfill the sick role. So they want the rest of society to give them an identity as this poor person that needs our help and support. Yeah. So what you're suggesting is a sensitivity to getting ill, but I don't think it's quite the same because they're not faking an illness. So that's another element of Munchausen's. They fake illness, they fake symptoms, they fake blood tests, they doctor shop. So if one of the doctors starts suspecting them, they will change their GP, etc., etc. They'll move cities, they'll change their names and date of birth so their medical records don't follow them. So those are all behaviors of someone with Munchausen. So that's not quite the same as what you're talking about. I don't think, I didn't see the Joe Rogan thing, but I would respectfully submit that this is not psychosis, because even though it's an extreme way of thinking, it's not outside of reality, and they're not delusions because they're understandable. I mean, they're not like completely wild, crazy beliefs that don't make sense at all, like the FBI's following me or like my next door neighbor's a paedophile when there's no evidence. It is an extreme version of somebody's personality. And that's what I think has happened with this pandemic. It's shown that some people are hyper anxious. So even some of my friends, even some of my neighbors, like literally wouldn't leave their houses for weeks during lockdown, even after lockdown, and wouldn't have their kids around any other kids that have had the virus, even if it was months ago and they're fully recovered. And then you get some people, I probably put myself in this camp, who are just a bit sort of laissez-faire, like, I follow the law because I have to, but I'm very
is that why you follow the law? Because you have to?
Yeah, that's what I'd say officially on a podcast. So I guess what I'm trying to say is I don't think it's mental illness. I think it just really exacerbates your natural personality, your natural tendencies. So if you're somebody who is naturally anxious, either anxious for health reasons or anxious in general, or just has a sort of pessimistic view of the future and just think that things will go bad and the glass half empty, or if you're scared of the police, then for all those reasons, you might be hyper aware, or your behaviors might be extreme in terms of following all the lockdown rules and avoiding the virus and washing your hands, blah, blah, blah. I think that's a form of anxiety rather than any kind of mental illness. Well, I mean, I should rephrase that. Anxiety is a mental illness, but any kind of psychotic mental illness where you're out of touch of reality.
You say it's not delusional because there is a virus, it does kill people and it can seriously affect you. So people might overreact from anxiety, but it's not delusional.
Exactly. That's exactly what I'm saying.
I was actually desperate to ask a psychiatrist or a psychologist the following. I recently did a video entitled "My First Experience of Gang Stalking." Now, I've never... I watch videos of these. I watch videos of middle-class people, rich people, and they all suffer from this delusion of gang stalking, and they describe it in a way. And you know what gang stalking is, don't you?
I don't think so. No.
Okay, it's an American thing, very modern, came with the internet. A person who believes they are a targeted individual being gang stalked believes that there is a giant with mass numbers, dozens, maybe hundreds of people in their neighborhood, all playing a part, like a kind of twisted Truman show, that there might be a drug dealer or the government, the FBI, the CIA, that is organizing all your neighbors to be whispering, making phone calls about you, taking photographs. So it's paranoia and delusion, isn't it, in a way?
That sounds...
And so I did a video, and I got to be careful how I describe the situation, because I'm still waiting to see if the police are going to chase me. I'll speak about it vaguely, but with enough detail. There was an incident on a train where someone was getting annoyed by someone else. Some strong words were said. Someone may or may not have burst into tears. And the entire train, then every single passenger on the train then turned on me as if I was the reactionary. A person was doing something which I found distasteful and antisocial. I commented about it. And the entire train, every single passenger turned on me because I was the tall, bearded, American-sounding, different guy. And they were all, for example, normal working-class English people on the train. And I could see with my own eyes that they all started conspiring. Yeah, he's definitely the one that's wrong. Then the person got off the train. The conductor stopped the train at Todmorden. The conductor came with two staff members of Northern Rail. They stood above me, shouting at me. And I'm like, guys, have you lost your minds? They're shouting at me. No desire to investigate. I am the guilty party. And he goes to me, you're going to get arrested at Manchester Victoria Station. I'm like, what? So we get to Manchester Victoria. He disables the train doors until the police arrive. There were travel safe officers. And he's like, it's him. He's the one that did this. And then they followed me. And there was like 4 of them following me. The police then followed me down the street. And it was a very comical, fun video because I knew what was happening. I knew it wasn't a delusion. They were following me. But by tagging it as a gang stalking video, about 50,000 extra viewers came from America saying, oh my God, Charlie, you're a targeted individual as well. And other people commenting saying, wow, this is the first example of gang stalking I've seen. Now, before I ask for your opinion, I want to clearly separate. What I think I suffered was, the kind of salt of the earth people finding an alien, looking for a scapegoat. And yeah, he's the one, let's scapegoat that guy. He's different. Just as well I wasn't black or Indian, it would have been even worse. But that wasn't gang stalking. But true gang stalking is when they believe that the entire neighborhood has been being paid on the payroll of like Jeff Bezos or the CIA to fuck your shit up, mess with your life. So I don't even know how I turned this into a question. What do you think of all that stuff?
Okay, so that's really interesting. So first of all, I have to ask, the people that turned against you, did they see what happened between you and
they were all
and
sat nearby, yeah.
So they saw the interaction, they still blamed you.
Yeah.
So it wasn't like one of them it wasn't like her friend blamed you and then everyone assumed that she was right. They actually saw what happened. And they
all watched it.
Well, in that case, either you did something wrong, but you've not realized that you've done something wrong, which is a possibility, or it's just absolute judgment, isn't it? As you said yourself, they've taken the taller, scary-looking person, they've assumed that that's the perpetrator versus what I assume is a young, naive, innocent-looking victim.
Yeah, that's exactly it.
So I think that's judgment, and as to why the whole train got involved is very bizarre. I can only assume, I don't know how to explain that really. Because
I'll tell you the situation. There was a person who was maybe 16 to 18 years old, listening to music loudly on the train, loudly. So I said, excuse me, could you please turn that down? And they said, yeah. 2 minutes later, straight back out. And then when I complained again, the person says, oh, shut up, old man. You're ugly. You're a twat. Shut up. I can do whatever I want. So I gave some strong words back. The person started crying, and the whole train turns on.
And it's a young girl, was it?
Yeah.
Or a boy?
Yeah.
Okay.
Yeah.
So I can understand why people would assume. Well, actually, no. I think most sane people would either stay clear of you because they think you're a bit of a psycho, or would probably either think you're being a little bit harsh but reasonable, or would fight your corner and think what you did was appropriate. But I cannot understand why an entire train full of people would turn against you. If not because British people are awkwardly polite and don't want to get involved in anything more than any other reason. So I don't know what happened there. I do wonder whether there was like a mob mentality, whether when some people did it, they just thought that they felt more emboldened.
I think, like in the Colosseums of Rome, we want to see someone get it. There's got to be some scapegoat. We've seen parts of society in history. It's got to be their fault. I think I became the sacrificial lamb. I became the Jew, to be controversial. I became the outsider.
Yeah.
And even like during the exchange, I even said, like, come on, young lady, why do you think it's appropriate to force everyone on the train to listen to your music? And I said it in the same tone, same loud, but not shouting voice. And then people from like 10 seats away said, no, you shut up. Her music's not bothering us. I'm like, okay, I'm sorry.
Yeah, I do think the more you describe it, the more I think that it is just a sort of social judgment because she's young and female, and you're
and the waterworks came out. So yeah,
I think that was it. But the other thing that you were saying in terms of gang stalking, I've never heard that phrase before, but what you're describing is absolute barn door psychosis. So that is a very typical presentation. So as I was saying before, the Joker believing that he had a relationship with actual events is not a realistic depiction of psychosis, but believing that everybody is involved in some kind of conspiracy is, I see that kind of presentation at least once, maybe twice a month. So it's really common.
No, of course. Have you ever had, you don't need to answer because you're professional, personal, but have you ever had a psychotic episode or a delusional spell yourself?
No. I can, I've got something to add to that, but I'll tell you in person.
Yeah, no problem. Well, like I've had, without going into too much, when I was younger, like a decade or two ago, I made friends with people, and they were, German guys. And they took me into this Hungarian restaurant, and I'd been drinking, and then I thought I overheard someone say something about we're going to get them later, and I suddenly realized I was a naive 20-year-old. I didn't know these 40-year-old guys, and I literally believed for about 5 minutes that they were going to take me into the kitchens and murder me. Is that a psychotic delusional moment, or is that just general paranoia? I believed it. I truly believe it.
So before I answer that, what was your general mental state before then? Were you happy, normal in the hours and the couple of days before then? Or were you experiencing anything?
Fine.
Okay.
Yeah, perfectly fine. But I'll tell you, just to give you some background, we were in their office watching conspiracy theory videos about reptilians, which I don't believe in the slightest. But it was very eerie, very scary videos. And then I'd forgotten about it. But then hours later, I suddenly said, who the hell are these guys? I don't know them. And I'm out partying with them in some Hungarian restaurant in the basement.
And were you quite pissed? Were you quite drunk?
A little bit. No, moderately. Moderately.
Okay. I can't say for definite without the benefit of assessing you at that moment in time, but I don't think that's psychosis. I think that's just like an extreme reaction to just feeling really unsafe. And when you say you heard them say that, like, do you think they said something along those lines, but you, like, in English, presumably, that you heard them say?
Yeah, they were speaking in English to be polite to me, but one of them turned and I kind of half caught it.
Yeah.
Like, it was some comment like, wait till we get him later, or we're going to wait till he goes downstairs, or something about something was going to happen. I misheard, and I was then too scared. Me now, I would have said, Hans, Fritz, what the fuck were you saying, Hans? But I was too scared at the time.
Pity it wasn't a 16-year-old girl. You would have made her cry.
Oh, okay. I said, turn your fucking music, turn your music down. Yeah. Well, I think I don't even know how long we've been going. Oh, 2 hours. No, an hour and a half, hour and 15 minutes. We've done quite well. But can you think of anything else that we've not covered that we should cover?
Not really. I was going to plug my YouTube channel a bit more if that's not too cheeky.
Oh, please, no, absolutely. No, go on.
Cool. So yeah, it's called A Psych for Sore Minds, and it's basically about what I do. It's the area of what I do for a living, so forensic psychiatry. So it's about mental illness and criminality and like the crossroads between the two. So I psychoanalyze high-profile cases. I talk about my own individual patients, although obviously I anonymize them and change some demographic details. Talk about individual diagnoses. So if your viewers are interested in that kind of thing, then they should go definitely check it out. My only other comment, Charlie, is to compliment you on your questions. So I do quite a few podcasts, and do bits and pieces of media, and I always get asked the same questions over and over again. You know, who's the most dangerous patient you've ever seen? How do you switch off? Blah blah blah. But you've asked me some questions that I've never thought about before, and used some words that I don't think I understood at the time.
Yeah, that's just me. This is me showing off out of insecurity. You know, you're gonna bravado. You know, it's like a guy with like a kind of souped-up Rolls Royce. Look at my words. Look at my words. No, that's really, really good. I just want to say to all my viewers as well, it was actually, you know, I feel like I've got a few bases covered. For my legal stuff, I recommend the Black Belt Barrister, Daniel, fantastic channel who's just gone over 100,000 subs. Well done, Daniel. And it was actually Daniel from Black Belt Barrister that recommended I speak to Dr. Sohom Das, and I'm very glad I have. I found it very enlightening. I think it's very cool. We went to the same university at the same time together. And thank you for your compliments on my questions. And to all my viewers, I've spent all morning, literally all morning, 4 hours, listening to the good doctor's podcast, A Psych for Sore Minds. See what he did there? A Psych for Sore Minds. So I will link it all below. And Dr. Sohom, thank you very, very much.
Mr. Veitch, it's an absolute pleasure. Really enjoyed talking to you. Thank you for your time.
Thank you.
Goodbye, sir.
Goodbye.